Hi, I'm Dr. Brian Thornburg. How do you know if you're providing your child enough iron in their diet to have adequate iron stores? And this is really, really important because we need the iron to carry oxygen, and the oxygen's used by our cells to make energy. So let me explain that process. When we take a breath in, we breathe in oxygen. The red cells will pass by our lungs, pick up the oxygen, transport it to the cells through the blood vessels. The cells will absorb the oxygen and then use the oxygen to make ATP. And ATP is essentially the gas of our body. And we need that gas to fire up everything that we do, from seeing, thinking, swallowing, going to the bathroom, walking from A to B, making bones, teeth, tissue, DNA synthesis, DNA repair. So we literally use it for every single functioning system inside of our body. That's why having adequate iron stores is so important. Now, in this video, I'm going to review when we check iron levels in the body. Well, actually, we check hemoglobin levels, which is a proxy for the iron. What are the different types of iron? What ages need more iron than at other ages? What foods contain iron? And how we can augment or improve our iron absorption, and how we can limit those things that decrease our iron absorption. So we check hemoglobin, which is the proxy for iron, because hemoglobin needs iron in order to carry oxygen. So if we don't have enough oxygen, our hemoglobin is going to be lower. We use hemoglobin as a proxy because we can't directly measure iron in the pediatric office. And so we check iron at the 1-year-old well child, 4-year-old well child, 11-year-old well child, and again for young ladies once they start their period. And we do that every year because of the menstrual blood loss. So the different types of iron are heme iron and non-heme iron. Heme iron is much more bioavailable, much better to consume because our body can uptake it much better than the non-heme iron. Examples of heme iron are going to be meats, seafood, and poultry. Examples of the non-heme iron are plants, refined grains, and some animal products. So it's really important to understand what types of iron you're feeding your child. If they're predominantly on a plant-based diet, which means they're receiving the non-heme iron, then they need to eat almost 2 times as much iron in order to absorb the needed iron to maintain adequate stores. So pay attention to the types of iron that you're feeding your child. We need increased amounts of iron at different points in our life because we have increased metabolic needs. So that means we have increased physiological needs, which means we need increased amount of energy. And these are going to be in infancy. This is going to be in teenage years, and for performance athletes, as well as pregnant women, and for some people who have medical conditions such as GI conditions like Crohn's disease and they have poor digestion and absorption, they're going to need increased amounts of iron. So pay attention to the age group as well as to the activity level or any medical conditions that might exist to understand what iron needs are needed. The best place to find out how much iron is contained in different types of food is just Google that. Just Google high iron foods, and then that'll give you a list. And that way you can focus your child's, your family's meals around high iron foods. And the last area I want to discuss are what help us absorb iron and identify what limits us from absorbing iron. So first, we want to make sure that we're eating heme iron because that's the most bioavailable. Second, we want to cook in a cast iron skillet because that cast iron skillet has iron, and then that will leach into the food, and then we're consuming additional iron when we eat our food that's cooked in a cast iron skillet. We also want to eat vitamin C containing foods because the vitamin C helps us absorb iron. And this is true both for heme iron as well as non-heme iron. So it's especially important for those who are predominantly on a non-heme iron diet. This boosts the absorption by 2 to 6 times. So it's really important to pair non-heme iron foods with citrus foods to help us absorb the iron. And for the non-iron containing foods, you can soak, ferment, or sprout them. This boosts the iron concentration in the foods and it makes it more bioavailable. So what are the inhibitors that keep us from absorbing iron? Calcium-rich foods such as dairy. It could be oxalates, which are found in spinach. It can be phytates, which are found in grains. It can be polyphenols and tannins, which are found in tea and coffee. Eggs and soy can also bind the iron, which then makes the iron unavailable to absorb. And last, high fiber diets also limit our ability to absorb iron. So make sure you're paying attention to the foods that you're feeding your child in order to ensure a higher iron content. If you have any questions, you can always go to your pediatrician and ask them to perform a hemoglobin test. This is that proxy to see if there's enough iron. And then for those who are performing and eating right and they're still low in iron, then what you can do is you can give a product called Floridix. It's a natural multivitamin that that contains the non-heme type iron, and you can just follow the directions on the bottle. And that's what I do. And that almost always resolves the issue. If after you're feeding well and you're doing everything that you should be and there's still low iron, then you need to speak to your pediatrician to look deeper to find out if there's some type of genetic condition or some type of GI condition, or there's something that's just being missed in the diet. Thanks a lot for watching, and I appreciate you following me.